my last question for you, I'm going to hit your sweet spot because of your career and what you do. And we get this not often, but every once in a while, the guys complain about of this. So as a doctor and a dermatologist, you know, what advice do you have? What products? I'm going to put, you know, this question obviously is going to be its own Q&A. I'll put links in it. So any products that you could recommend, any hygiene tips, anything that you can recommend from a dermatological perspective to help, because we do every once in a while have clients that have facial acne every once in a while, but back or shoulder. Mm-hmm. So any tips would be greatly appreciated. And like I said, I'll include links in the video so that people can order any products that you recommend. I'd love your advice on that.
Yeah, well, the first thing one should realize regarding the relationship between testosterone, TRT, and acne is there are two things. First, every hormonal change in sex hormones, if it's estrogen, progesterone, or testosterone, every hormonal change influences and stimulates breakouts. So you get more acne with every change of hormones. We see that in, of course, teenagers because they have a lot of fluctuations, a lot of changes in hormones. We see that in young women that have been taking birth control pills for years. Sometimes they stop because they want to get pregnant, or because they stop a birth control pill and they change to a intrauterine device. So all these changes, stopping this pill, changing for another type of anticonceptive, whatever, they can cause breakouts. The same thing goes for the TRT. If you suddenly from one day on the other take TRT, your levels go up. That's an enormous change. So a lot of men, I've noticed that have breakouts. It's especially in the first few months of starting TRT, and that's because of this change in hormones. So that's the first thing. If you realize it's the change, and once your levels get steady and you adapt to it, like after teenage years, then breakouts diminish gradually. So that's one thing a lot of men on TRT should realize. After a few months, if you have breakouts of acne, they will gradually fade away. But second point is, of course, testosterone increases the sebum production of the skin. So the skin in men on TRT gets more oily than before. That's almost always the case. It's normal. And an oilier skin needs some more taken care of. You have to clean it more often. You have to use more detergents, more soap than before. A lot of men with low testosterone levels have drier skin, less oily skin, and then you need less detergents to take that oil off. Once your skin is more oily, more fatty, more sebum producing, you have to take that sebum off the skin regularly. If not, your pores will get clogged. Those clogged pores will cause inflammation, infection with bacteria, and so on. So the first thing men on TRT, if they get oilier skin, have to do is clean that face more often, twice a day, with a soap or detergent. There are a lot of products that are especially made for acne, all kinds of acne cleansers and so on. If you want, I will send you some links of good products that you can put in the description of this video. So that's for the cleaning of the skin and for the cause and the extra sebum production. So once your levels are steady, you're dialed in on TRT, you can also start taking some supplements to keep that acne at bay. If you keep on having recurring pustules, papules, even nodules or cysts, some people have really bad back acne.
Yep.
And that's really difficult to take care of with just topical soaps and so on. So before getting to a dermatologist and starting some antibiotics or sometimes even isotretinoin, that's Accutane in the United States, you can try some supplements as well. So there are a lot of supplements one can take that influence acne and that can be good for it. So first is vitamin A. like Accutane is also a vitamin A derivative. So if you can take a vitamin A supplement, that can also already be helpful in the preventive manners for acne. So that's generally 5,000 units a day of vitamin A. And next is zinc. Zinc is also a classic supplement in the acne category. Recommended doses are there 20 to 30 milligrams a day.
Okay.
Also selenium, as we already mentioned, selenium is also anti-inflammatory and good for immunity. So it's good for the acne infection and the pustules. So the recommended doses are there 200 to 400 micrograms a day. Also magnesium, because magnesium is anti-inflammatory again. It decreases the levels of cortisol in our blood. Magnesium is also very calming and soothing, so it's rather a nighttime supplement. You take it in the evening. It helps calm you down and decrease that cortisol level. So that's 600 to 800 milligrams a day. Also, omega-3 fatty acids, of course, are very good because those regulate the type of oil production that becomes the sebum. So omega-3 fatty acids are also good for general health, for the heart, and so on. I always recommend them to everyone, actually. That's 2 to 3 grams combined DPA, DHA, EPA, DHA. They combined 2 to 3 grams a day. And then L-carnitine. L-carnitine is also a very good supplement you can take for acne. That's 3 times 250 milligrams a day, L-carnitine. And one more, vitamin B5, pantothenic acid, is also a good supplement for acne. I know that's a lot of things to take. There are some combination preparations. You can find them on Amazon as well. I will send you some links there. And of course, everyone should take vitamin D3. Everyone should take it because that's the only vitamin that's also a hormone. It's good for a lot of stimulation of the immunity, the bones, a lot of good benefits there of taking vitamin D. And I guess that's about it. Yeah, there are some discussions about taking probiotics and prebiotics for acne, but there's still research going on about that. So I think that's about it. And if those supplements are not enough, if you really get really bad acne on TRT, you should go see a dermatologist, and he can help you with some local products, antibiotics, and maybe even oral antibiotics or tretinoin Accutane.
Yeah, we had 2 guys who've had a bad back acne, and thanks to your recommendations, there was, I think, a soap brand that you recommended that helped, and also we changed oils and we changed esters that seemed to help. So thank you for that in previous, because I reached out to you a couple times on that, on which products to use, which was great. On the vitamin D, do you recommend a dose? We typically in the practice recommend 10,000 units a day to build up levels if they're deficient, and then 5,000 to maintain. Based on the data we collect, we find that it's very underprescribed, and most doctors, general practitioners, tell people that they're low in vitamin D but don't give them good guidance and never run follow-up work. So they're perpetually, every annual check-in with their primary care physician, they're low vitamin D every year.
But it's a problem of lab ranges here as well, because lab ranges here go for vitamin D. I don't know the units by heart, but it's 20 to 40 something. And all the experts, doctors that have been on my channel, they have been recommending being over 80, 100, 120. I don't know the units by heart, but so the lab ranges here are ridiculously low. So GPs, general doctors, are very very rapidly satisfied with the low numbers their patients have, and actually almost all men are very low, 30-ish in that range, but that's way too low. So the same thing as you said, I recommend 10,000 units a day to get those levels up, and once you're there, since it's a fat soluble vitamin, you keep those levels up with 5,000 units a day. That's what I take every morning, together with the omega-3 fatty acids, because you get better absorption when you take those fats together with the vitamin D.
Yeah. We also combine ours with vitamin K2, which helps with calcium, taking calcium out of the arteries and depositing in the bones, and there's some synergy there as well.
Yeah,
so I think that's an excellent
together as well. Yeah.
It's an excellent supplement. A lot of people don't know about it, and we're like you. Our range here is 30 to 100. We typically tend to guide, minimum of 70. We like to be closer to 100. And where I think a lot of doctors fall off, and this took me even a while to articulate it, is we have these lab ranges and we know that certain things are healthy. And what I think we should be asking of our medical professionals is, why wouldn't I want to be on the high side of, so for example, vitamin D, if our range is 30 to 100, why would you not want your client closer to 100? B12, the range is 200 to 1100. Why not be in the upper 50% across all of these positive metrics?
Yeah, I have no idea. Doctors are already content when people are lowish but normal. But normal, why don't you want to be optimal, better performing, better feeling, and so on? So there's always a big difference between normal and optimal. And yeah, our channel is all about hormone optimization and feeling better and get your life as optimized as possible. We don't want to be normal. We don't want to be just looking like the general public. General public is not healthy, so we don't want to be in their normal ranges.
It's true. I'm sure you've heard this from a lot of people you interact with that haven't started TRT yet, but we get this a lot. Like the general practitioner will run, a guy 52, testosterone is 350 or 400. The range is, I think it's like the lab we use now is like 250 to 1100, which is a crazy range. And they basically say, hey, you're 50. What'd you expect?
It's normal.
Right? Like, it's sort of crazy. What do you expect? Do you think you're going to have good testosterone levels forever? You're a 50-year-old guy. Feel terrible for the rest of your life.
Yeah, you're just getting older. That's normal. I feel that as well.
It's crazy.
Yeah, well, most doctors are crazy. That's what COVID has told us as well.
Yes, 100%. And what I'm surprised at is that, even though there were some decent articles out there on COVID and vitamin D, and I know it's correlation versus causation, but 96% of the deaths, I think, in America at one point was related to, or those people who passed away had very insufficient levels of vitamin D. And again, it's a correlation, not a causation, but it's a strong enough correlation to be a wake-up moment to say, hey, let's get everyone into the upper echelon of vitamin D. As you know, because it's fat-soluble, people who are heavier and have more body fat tend to need higher supplements ranges, and they tend to be lower in vitamin D as a result of that. And so, again, there wasn't enough, I think, education for the general population in terms of what was going on, COVID and general health and trying to get healthy. And I think it was a there is the great reset that everyone talks about that realizes what's going on. I feel like we had a missed opportunity because we could have reset everyone's health. We could have articulated to everyone in the world, listen, you need to get healthy. You need to lose weight. You need to focus on health. You're going to reduce your risk of passing away. Look at Japan. Japan has 2% obesity. They had very few COVID deaths. South Korea has 4% obesity, very low. And when you look at the demographics across all countries and the COVID statistics related, it's not by chance that countries that have higher obesity levels in general had higher percentages of death across their population versus the ones that have very low levels of obesity. And it's common sense that was never articulated and propagated out to people.
Exactly.
So I think that it was a real huge missed opportunity for all of us to reset in this 2-year period our health and become healthier and more focused on that.
Yeah, I'm afraid a lot of people, even diminish their health by working out less. Their sports clubs was closed down. They had to stay home unless of cycling to work every day. yeah, a lot of people, they ate less healthy. They worry too much. A lot of people lost their businesses, so they stress a lot. Yeah, health is on the way down since then.
Well, listen, let's hope that more people follow your channel. I don't have quite the following you have. I'm trying to build up. Hopefully they follow mine as well. Please, everyone, subscribe to his channel. It's excellent content. It's all about getting healthy, optimizing hormones, optimizing testosterone. It's not only testosterone related. They talk a lot about peptides. They talk a lot about other therapies that are going to improve your health. Steven also has trainers on, so they talk about some of the issues that they have with their clients and when their clients are low in hormones. So subscribe to his channel. He just gave amazing advice on how to deal with acne if you end up experiencing that when you go on testosterone. So please like the video, like all of his videos, follow him. And Steven, thanks a lot for being on the show. I really appreciate your time, and hopefully we'll have you back and get into some other topics.
It was my pleasure, Brian. Thank you so much.
Awesome. Great.